Good afternoon. I'm John Urbans, President and CEO of Greater Fort Wayne, Inc. I'd like to welcome you to our latest in a series of webinars focused on a roadmap to a healthy reopening. We've spent the last several months working to ensure that businesses and places of employment have the proper health information to help reopen the economy. Today, we'll be focusing on the return to school. As a father of three, I'm very interested in making sure that our parents and students have the best information available. I'd like to thank our partners for today's webinar, Parkview Health, the Allen County Department of Health, the Northeast Indiana Regional Partnership, and our team at Greater Fort Wayne, Inc. Today, you will hear from a number of experts, as well as have the opportunity for questions at the end. I would like to thank those that submitted questions ahead of time. Those questions helped shape the webinar that is being presented today. Today's speakers will be Dina Jackway, Chief Community and Human Resource Officer for Parkview Health, Dr. Tony Giaquina, Parkview Physician Group Pediatrician and President of the Indiana Chapter of American Academy of Pediatrics, Mindy Waldron, the Administrator of the Allen County Health Department, and Dr. Michael Knipp, Parkview Total Health Chief Medical Officer. At the end of the presentation, the chat function at the bottom of your screen will be open for you to submit questions. If your questions are not answered during the webinar, there will be a phone number at the end of the presentation that you can call and ask additional questions. Each participant will receive an email following the webinar with a survey and a link to the recording and the slides of the presentation. With that, I'll turn it over to Dina Jackway from Parkview Health to get us started.
Thanks, John. As a trusted healthcare provider here in Northeast Indiana, it's our family of 13,000 taking care of your family and meeting the community's healthcare needs. Over these last several months, we've also been helping businesses and industries, helping them reopen safely, going through their recovering process as they're beginning to open for business. And that also includes schools. And not only as an organization, but as a parent of 3 boys, we know that opening schools safely is such a critical component to us being able to move forward as a community. So we've been listening, and we're here to help. We have spent the last several months partnered elbow to elbow with schools and learning what their needs were, but also hearing from you as parents. We sent a survey out across Northeast Indiana and really thrilled to have over 7,700 people respond and tell us what's on your mind. What are you nervous about? What are the concerns that you have? And that feedback actually led us to what we're bringing you today. We took your voice. Your voice is so important in this, not only for the safety of your own children, but the community at large. We also took into play the guidance from the CDC, from Indiana's in-class guidelines. And again, working with school districts. We've appreciated the partnership with so many of our districts to bring things such as webinars to them. We've been working with superintendents, the principals, the full teams at large to help understand what's on their mind as well, so that again, we can bring everyone back safely. We've also enjoyed having many of the school districts reach out and want to have us do a tour of their facility to point out the things that we're going to need to be thinking about, again, as we reopen. We start a lot of our webinars talking about what's the current state of COVID today in our community. And for us in Indiana and in Northeast Indiana, it's community spread. That means that the source can't be pinpointed, which means that as we all engage in the community, we are just as susceptible, whether we're at the grocery store, whether we're at a wedding, whether we're at a birthday party, or simply at work. And so it is something just with children coming back to school. It's important that whether they're in school or it's a football game or it's a birthday party, they are also in a position where they're equally at risk. And so because of that, we have to think of all of the continuum of ways to keep people safe. These school plans are based on making sure that not only parents are informed, families know what's happening with their children, but keeping both the children and the faculty and the staff within the schools very safe. We recognize that many of you right now have either already received your school district's plan or you will be receiving it. And as part of that, you're going to be faced with a variety of decisions to make. And our goal today is to help provide you with some guidance around a variety of things that you may encounter as you're reading those school plans and how best to equip yourself to make what I know is a difficult decision for so many of you, and certainly myself included. We're going to cover today in this presentation and have a variety of key stakeholders share their expertise with you, not only internal within Parkview, but also from the Department of Health. And we're really going to hit on three major categories. The why. To start with, the why there are even these plans. We know that there's a safety component certainly to them and how we're keeping our children safe. But what is the impact on children? And Dr. Tony Giacquina is going to talk about that. The what you might expect. So we know that all these plans are different. And we also know that every child is different. So helping you between what your school district is providing and how you can make the best decision for your family. That's all part of what we want to be able to share. And again, giving you more guidance to equip you with information. And then finally, how you can support. As a parent, how we are going to be able to support and continue to have our children thrive and learn and continue to go on their education journey, whether that is in person, whether that is remote, or a variety of ways. We know that we have had to change the way that we've seen education over the last certainly several months. So now I'm going to turn it over to Dr. Tony Giacquina, who is not only a pediatrician here at Parkview, but also the president of the Indiana chapter.
Okay, can everybody hear me? Great. Well, thank you very much, Dina, for that introduction. Yeah, this is a really complicated issue for children, right? Children have been impacted very greatly by coronavirus. But importantly, that's not exactly because they are getting sick with coronavirus. And let's go back, especially when we're talking about schools, let's talk about the three main reasons why we did shut down schools way back early in late March, early April. It was for three reasons, right? We were worried, number one, that children were going to be in danger of coronavirus. We certainly saw what was happening in Lombardy, Italy, in New York, and we saw adults getting extremely sick and dying of this disease. And our most precious commodity, our most vulnerable, often when we're talking about infectious diseases, are our children. So we shut down schools to protect them from the disease. We also shut down schools because of our experience with other viral diseases like influenza. Influenza spreads rapidly through children, and they are often the main vectors of spread. And so the thought there was, if we shut down schools, we can prevent not only the spread of disease, but also the morbidity of disease in children. And then finally, and this was the real big one, this was going to be a public health measure to flatten the curve, okay? We were seeing our hospital systems completely overwhelmed from coronavirus. And we saw this again in our own country, in New York, and definitely in Lombardy. And so this was a all hands in approach to stopping the spread of disease. And we shut down businesses, we shut down pediatric office practices. I mean, this was a really drastic measure, and shutting down schools, while a decision that was not made lightly, was definitely a strategy to hopefully control the spread. So now that we are now 6 months into this pandemic, and indeed pandemics are best understood in retrospect, so we're learning a lot as we go, we are finding out more information about how this disease does impact children. The one question that I hear, can children get coronavirus? Absolutely yes. We are seeing many more children now being tested and are showing up positive. And you can see that in the top graph that the children, or at least young adults, 0 to 29, is starting to become the major player in coronavirus positives in our state. And this is a state data. If you tease that apart even further and you look at just young adults, most of that uptick is the young adult population age 20 and above. But the other population, children 20 and below, is still rising slowly. So yes, children can get this disease. But what is very important is asking ourselves, are children in danger of this disease, okay? And for me, what I am telling parents is, I am worried about a lot of things as a pediatrician. I am worried about drowning and the thousands of kids that drown every year. I'm worried about my teenagers, the 7,000 children that die of suicide every year. I'm worried about all the children that are victims of car accidents every year. But one of the things that is not keeping me up at night is the danger that coronavirus is posing to children. Okay, yes, children can get sick from this. They can be hospitalized, but it is very, very rare. As you can see by the graphs, the risk of hospitalization in children is, if you look on that right-sided graph, that little tiny red square represents children ages 0 to 19 versus the number of cases. And then when you look at deaths, we are so fortunate, everyone, that this disease has spared children for the most part. We are seeing very, very rare causes of death due to coronavirus. We have not seen one in Indiana yet. There have been cases, but again, exceedingly rare. I'm worried about a lot more things causing deleterious harm to children than coronavirus. And then, of course, there's this multi-systemic inflammatory syndrome in children. This is something that we're learning more about. We did see a number of cases in New York, but we haven't seen a ton of cases since then. And maybe that is what we're seeing is that this is a condition that we see maybe about a month after children get infected with coronavirus. And so maybe we'll see more cases, but we certainly have not seen many at all. It is still exceedingly rare. And is not something that I am really worried about compared to other dangers for children. And so this is really the crux of the debate, right? And that is, if we know that children aren't in harm from coronavirus, but they can spread it in certain situations, is it worth it to have children in schools? In other words, do we still need to keep schools closed to help flatten the curve? Are we able to keep schools open and keep them open safely to protect our educators, our cafeteria workers, and our bus drivers? And what I want to tell everybody is that the goal must be that we open schools. That must be the goal. That has to be the starting place of discussion. Now, that is not a 100% all in, we're going to do it no matter what, but we must keep this as a goal. And so we must vigorously strategize ways to keep schools open and to do that safely for a number of reasons. And it is more than just the value of education, which I think most of us would agree does take place much better in in-person education, both due to young children having difficulty with online attention span, and also with adult children just needing that peer-to-peer and peer-to-teacher interaction that is best found in person. But I do bristle a little bit when I hear that the debate is only, will education be the only thing to suffer? And if we can maximize our online learning, then would it be just as well to have them at home? I will admit for some children that may be the case, but not for all. And in fact, for many of our children, I have to remind people that 20% of the children in Fort Wayne are living in poverty, okay? And in my practice alone, I see 30,000 children, about 75% of them are Medicaid, which means they are living very, very close to the federal poverty level. And when you get to that level of poverty, and then you are also dealing with many other toxic stresses that are impairing their safety, their health, and their growth and development. And the truth of the matter is that many of the protective mechanisms for those children can only be found in school. And so when we discuss about whether schools should be open or closed, we really have to take the full measure of a child's health. And gosh, you guys, this is an hour-long topic to go over all of these, but suffice to say that some of these we just cannot forget when we are talking about a child not being able to get in-person learning in a school. Maybe for me, one of the most important is coping skills and mental health. We have not had a child die from coronavirus in the state. We have had children die from suicide in the last 6 months. And one of the most important things that schools provide is a safe, warm, nurturing environment that lets them take some of their anxieties and spread them out amongst their peers, spreads them out amongst their talents, their activities, their hobbies, and it prevents anxiety from going into depression. It prevents depression from increasing suicidality. And when we're talking about safety due to coronavirus, a lot of that is really due to some of these categories that I'm really worried about sacrificing if we keep kids from home. Next slide. And so now I'm going to turn it over to Mindy Waldron, and she'll talk about why safety measures matter. Again, you know, if this debate about whether to hold school in and out is going to depend on a lot of factors, but I always just want everybody to remember is that the full measure of children's health is not just education, and that we might not be discussing just your child's safety, but our community safety as well when we talk about a big decision like closing schools.
Well, good morning. I'm Mindy Waldron. I'm the administrator of the Allen County Health Department. Appreciate the opportunity to share some thoughts with you today. Thought I'd start with a little bit of the why in terms of implementing some of the prevention measures in schools. And Dr. Giaquina is exactly right in terms of the risks with kids, and we're very glad about that. The concern and some of the things that we are seeing currently are that kids tend to be super spreaders in some cases, and so we do want to minimize the chance that they might take that virus home to other family members as well, and to spread it amongst themselves, those types of things. So putting some of the prevention measures in play before school starts is going to be important, and it's important to understand why. So the Indiana Department of Education's guidance recommends that there be a closure every time there's a case for cleaning and to do contact tracing. We do have discretion though at the local level, and so we've been working very hard over the last few months with all of the schools here in Allen County and in some surrounding counties to determine some measures that could be put in place that might prevent those closures, that might minimize those. So what we would hope to see is that we would not have to be faced with these very difficult decisions every time there is a case. So the plans that the schools have been submitting, and some that you've probably seen or some that will be coming out soon, have a lot of protection measures in them so that it minimizes the number of people that are impacted. Because again, our hope is the more measures you have in place, the less people that were actually exposed, because it has to do with time and distance and some of the activities you're involved in. But we want to lessen those hard decisions. So I kind of consider this graphic my decision-making hopper. And when we've been meeting with the schools, we talk about the number of things they could do and the more of them that they do throughout the school year, especially through transportation, through the classroom setting, some of the activities, sports, and other extracurricular activities. The more they have in place, the easier it'll make the decisions. For example, assigned seating is going to become very important so we know who was where, and we don't have to quarantine a whole classroom, for example. We might be able to look at a smaller subset. And when we're talking about transportation, which will be very difficult for the schools, they're not getting more buses, so they need to figure out how it is they can do it as safely as they can. And while not everyone likes wearing the masks, myself included, it is something that is going to lessen the spread of the disease. So that will help when we're doing transportation or have classes that can't be appropriately distanced. It might reduce the amount of spread of the disease, but it still might result in some kids having to stay home if there's cases in their classrooms. We're seeing these things now, so we suspect that we will see some of those things. It's more about just being aware of what will happen. So all of these things that we've suggested, and this is a very small snapshot of the things that either IDOE or the State Department of Health or schools themselves have come up with for their plans, in the bottom there left is hopefully going to lead to fewer school closures here locally and easier decisions as far as which kids we need to send home. Thank you, and I'll turn it over to Dr. Nip.
Hello, parents from around the region here in Northeast Indiana, K-12. My name is Dr. Mike Nip. I'm with Parkview Health. I'm the medical director over at Occupational Health and also within the Total Health program. I'm also a parent. So I wanted to spend a little bit of time talking with everyone about what sort of additional safety measures to expect and what is school going to look like here in the next coming weeks. So the first thing I wanted to talk about is the hierarchy of controls, which has been implemented across the nation, is a structural approach that comes out of the industrial hygiene or industry realm. Whenever there's an exposure that could cause issues or harm to a person, it's at several different levels. The top one, just to go through it real quickly, is elimination. This is trying to get that hazard away from someone. The engineering level is isolating people from that exposure or hazard. An administration control is changing how someone works or interacts in the space where that exposure might be. And at the very bottom of the hierarchy is what's called PPE, or personal protective equipment. And this is something that someone would do to protect themselves, wear or use to protect themselves from that exposure. I just wanted to briefly bring this up because it has informed and produced a lot of innovative solutions in schools across the region. And this has been part and parcel of discussion myself I've had with a lot of school corporations in regarding how to make schools more optimally healthier and safer. So for this slide right here, I just wanted to bring back and combine the hierarchy controls with some specific things you're going to be seeing schools do this fall. The first one from the elimination wing is asking staff, teachers, and students who are ill to stay home. So they won't be in the school building where they could potentially expose someone else. Some engineering controls that you will see are there will be a lot of things done in spaces in the school to promote being able to socially distance or to put up a physical adjustment to the environment like a barrier or something like that to allow there to be a lessening of the exposure to someone. What we talked a lot about with schools is a phrase called fresh eyes on familiar spaces. So it's the, in theory, same classroom, same cafeteria, same common space or gym, but seeing if you can physically adjust or put in something new for the environment to help make that exposure less and make it healthier and safer. On the administration side, a phrase we've been talking with schools about a lot is the concept of clean hands in and clean hands out. And this is going to be supported by hand sanitizer stations, sometimes at classroom doors or entryways into schools or gyms or cafeteria spaces. So clean hands have always been important, but they've never been more important than right now. What we do recommend too, and you may hear this, that soap and water, it doesn't seem extremely exciting, but it's still the best option. But there are times when soap and water aren't available. So we do recommend the hand sanitizer. And so you'll see that as well. The other administrative technique or strategy we're going to be seeing quite a bit of is the cohorting of students. This is attempting as best as possible to have the same students track together, whether it be on the bus or perhaps going class to class, or if in an extracurricular activity like a sports team, having the same kids track together, as it were, in case there is a need to know who was closely around somebody else at the school. And finally, regarding personal protective equipment, masks are going to be a new facet for school this year. There have been some things come out from the state regarding who is going to be masked. We're now in a universal masking stage here in Indiana. Schools have incorporated in their plans at least regarding mandatory masks indoors and outside when you can't socially distance. This is coming down from the state at third grade or higher. Several schools I have been in contact with, this is going to extend possibly out beyond the third grade level, and it may highlight special consideration for vulnerable populations, both in the student and in the faculty staff arena. I did want to touch on just a couple points, and I'm taking off my physician hat a little bit and putting on my parent hat here, and just some things to keep in mind for us as a parent group. You may have heard this isn't a sprint, it's a marathon. I would even say it reminds me of even something like a multi-stage race, like maybe the Tour de France, where the terrain may change a little bit as we progress through it, but we are still doing the best we can, adjusting what we need to do to complete each stage of the course. And so what we want to focus on and remember is being consistent and diligent in what we're doing, but we're also trying to not miss the good to hit the perfect. At the center of all of this is the education of our children and the ability for teachers and educators to do just that, is to educate. And what has gone into a lot of these adjustments and changes that we're going to be experiencing together are trying to make the best choices are the most optimally healthy and safer choices, and trying to make those as automatic and easy for everyone involved to make those choices. So speaking to parents, we have to remind ourselves that we are tasked with, if we're expecting our child to do what's required of them by their school, we have to be good models. And we have to mirror that at home with being positive, even though sometimes it's difficult. We've all have probably been there, putting our kiddo on the bus or dropping them off for kindergarten the first day, and then we go ugly cry in the car as we drive away, but we still had that smile on our face. This may be some tough times for us, but trying to be as positive as we can, and being supportive of the measures the schools are taking to keep our children and our educators as safe as we can. And again, back to our multi-stage race concept here, we're preparing for and be supportive of additional changes that may occur during the school year, possibly moving from having education options that are more in person to temporarily not having those options and moving back and forth as the situation indicates. So I just wanted to spend a little bit of time here on some experiences that we're probably going to have our kiddos experience. Our first point here is, of course, the kids will be wearing a mask at school, but the expectation that we're not thinking it will be on them every minute of the entire day, as there will be some engineered in times where they will not have to be in a mask. For those that are bus riders or that take part in school-based transportation, looking towards having assigned seats on the bus, likely in the classroom, and then likely in the cafeteria as well. This goes along with the next point here with the pods or the cohorting strategy. So like we talked about, making it easy to identify the people who are around each other for a closer or extended amount of time throughout the school day. A good thing, I think, is the what that happens in the school. We're still going to see a lot of the same things. There will be gym, there will be recess, there will be educational experiences that we're used to, specifically with the hands-on opportunities. The how is just going to be a little bit different this year, incorporating again the strategies from the hierarchy of controls that the schools have adopted. So on the teacher side, what's the teacher experience going to be? They're going to be strongly supported in instructing in ways that allow children to learn the best way, all the while utilizing the safety measures, for example, the hand hygiene, the clean hands in, clean hands out we talked about, and also incorporating the reality of masking into the classroom, but not letting it alter the educational experience that our kids will have. Schedules will be probably one of the bigger places we'll all experience some flexing. These things probably will shift a bit to allow for some additional time for cleaning, to also decrease the amount of students that are close together in a certain space, like, for example, in a lunch line or at a recess or in gym classes. The other thing that probably will be a pretty decent shift is how and what extracurriculars will look like. So we're hoping as much participation is going to occur as we can into the fall and into the spring. How we will experience them as supportive parents and spectators may change as to how we can participate in viewing or being present, or where we might be viewing these events will change. But the intent is to, as much as possible, offer what is able to be offered as safely and as healthy as possible. So the other side of the experiences to expect are Potentially, our children may be asked to quarantine at home for up to 14 days if they are considered to have been involved in a high-risk exposure. Things coming down the pike potentially based on how things go is a classroom, a grade, or a school may need to be closed for potentially 2 to 5 days if the local health department identifies the need to do this based on COVID testing results, what safety measures were in place, and what else is needed to required to be to clean that environment so students and faculty can return back to the school environment. And so those are just some broad strokes on potentially what we might expect regarding the interaction of quarantining or closing of schools. But just to let me reiterate, we're all blessed in this region with very excellent local health departments. They are going to be taking the lead on communicating and leading regarding any quarantine or closing or temporarily altering the ability for us to.
All right, well, let's talk a little bit about some of the reasons why all of these things are important. And early on, since March, we've been meeting very frequently with the school superintendents, some of the coaches, athletic directors, a lot of the extracurricular leaders, that type of thing. It's been a very collaborative experience with these folks. They want to have the safest return to school and return to events as they can. So they have listened, they've asked a lot of questions, and then what came out of these discussions for the last few months was some trainings that we did for the schools here in Allen County, and we did also expand that outside of Allen County as well to those that wanted it. And it was to the public schools as well as all the private schools. We wanted to talk about scenarios so they kind of got a picture, and I'm hoping that a couple of these might just frame out a little bit of how we have to make these decisions. And while some of it seems extreme, there are things that can be put in place to lessen some of the impacts. So what they found from that was the ability to utilize some of our PowerPoints to train their staff to know what to look for, implement different measures. So I thought today I'd share 2 fairly simple examples of how we make those decisions when certain things happen. So I'll give you a scenario, and then I'll kind of talk about how this might affect things. And I do understand the impacts. I'm also a parent. And so what I want to say before I start with these scenarios, and because of the things that you'll be starting to hear about your school plans or your sports plans, those types of things, is listen to your school folks. Listen to what it is they're going to ask you to do as parents, because we don't want to have you impact things for the kids, for their activities that they may be involved in. So if they ask you not to attend something, or if they ask that the kids stay home for a certain period of time, it's going to be very important, to the extent that we can all be as cooperative as we can, to minimize this thing as it goes on. Understanding the impact, certainly not minimizing that part, but imploring upon you to be as helpful as you can to keep the kids in school as long as possible. So when we have scenarios like these, for example, this being just a teacher, could be any teacher, test positive. And things like that are happening daily here with people that work in a number of positions and are involved in a number of activities. So say they only used one classroom, but they have several classes that come in and out of there each day. This person worked a couple days while they were infectious, and that exposed about 200 kids and staff. So what now? What will happen here is we're going to have a reporting portal where we will be able to have a lot of information from the school fairly quickly when they have a case reported. And we'll look at things like, if we find that the teacher did stay in front of the class at least 6 feet from others and they wore a mask, this is like almost a best case scenario, there'd be very minimal risk of exposure because the kids will be wearing a mask as well, or they'll be distanced pretty well. Very few people would need quarantined in this situation because basically what they've done is everything right here. They've been distanced, they've had masking, and we would hope that some of their plans on how the classes pass, how the teachers themselves, when they go to lunch, some of the things that they do would be safe as well. And so we may only have to represent or ask that they do certain cleaning in certain areas of that school that the teacher may have been in. And they may not need to close. It might impact maybe a couple kids, depending on if the teacher moved about, those types of things. So our impetus when we get these cases, again, we're well into the mid 3,000s. Every day we're getting 30 to 40 cases. We go through these same things. What did they do? Where were they? Who were they with? Who's high risk? Who's not? So those that are not high risk would not be notified and would not have to change their activities. And then in our next example, this is where it gets a little complicated and it's sometimes frustrating, and certainly we understand that. But again, it's all about as much as possible safety. So say that we had a couple high schools that played football. This could apply to band, show choir, could apply to any activity. So a player on the team or the group gets sick on Sunday, is tested. They stay home on Monday. They do end up testing positive, and then they notify the school a couple days later. What now? We would, in most cases, need to notify that other team. We need to know where those teams were. Did they interact, or did they use separate locker rooms or not even use the locker rooms? Did they stay cohorted during that event on the sidelines and not mingle? Was it a referee? There'd be a number of different playings with this type of scenario, but we would also look back as to when they attended school, because it's important to remember that when someone becomes symptomatic, it's generally 2 days before that they're infectious. So they could be infecting folks while not even knowing that or not even feeling too terribly awful at that time. And then, as we know, we have many folks that may never show symptoms. So in this case, we may just recommend certain cleaning because a couple days have passed and it might not be as necessary to do a full school cleaning. But there probably would be some folks we'd have to put in quarantine. Anybody that might have been within 6 feet of these folks for more than 15 minutes. And with contact sports, such as football and some others, there might be times when we know that it's going to be less than 15 minutes, but when we're engaged in tackling or very close contact, sometimes those are one-offs. In other words, if that's the type of event that they're involved in, sometimes the folks that have been around them would be in quarantine. And so this could end up being a good portion of the team or the activity group, possibly some coaches. And again, we're working through those things now as kids have returned to sports. And so we're learning a lot as to how we can be safer. So again, I'll turn that over to Dr. Giaquinta.
All right, you'd think I would have figured out this telemedicine stuff by now. Great, so let's talk a little bit about the question that a lot of you have in your minds, which is, should I send my kid back to school? It's one that I get every day in my office. And honestly, that depends. We talked a little bit about some of the other big benefits that children get by being in school other than just education. They have their hobbies, they have their social networks, they have their supported, they have their nutrition often. And these are all little things that it's important to kind of put into your inventory when you're deciding whether to send your child back to school. And again, I'm a parent and I have to go through this checklist as well. And a lot of that's going to depend on, what is my child going to get out of the school? And also it's going to require a little bit of good faith that the school is doing everything possible to keep my child safe while they are there. And so these are kind of the things, again, that, is so important for discussions like this, and make sure that you are having close communication with your school so that you feel comfortable with the plans that they have placed to keep your child safe. We talk a lot about layers of protection. And so one thing that Dr. Nip said that was really important is that we are going to really, really make sure that we aim for the good and not absolutely look for perfection if we're going to sacrifice a lot of the other important things that are important to the school setting. And then also to make sure that it's within the scope of that class development. But a lot of these things are that are on this list, and you can find this on the cdc.gov/coronavirus, is looking, hey, does the school have a plan? And is that plan congruent with current recommendations to try to keep social distancing, try to keep the risk of disease spread by monitoring symptoms, and also making sure that masks are a big part of that day. Again, when we layer these things on top of each other, we are going to have a very, 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 very high confidence that your child is going to, A, be safe, and also protect his other students and staff. The other things that are important about this list is it also looks at your child's needs with school. What are the big things that your child gets out of school, as well as their comorbidities? Are they at more vulnerable or high risk? I have several students that have severe asthma, and they're asking me whether they think that it's safe to go back to school. And I tell them, that depends a little bit, but overall, I absolutely think it is in many times the best interest for them to go to school. We know that children, again, aren't being very hospitalized very frequently with this, even with comorbidities. B, we know, like in the case of asthma, there are no absolute contraindications to wearing a mask, and that is something that is very safe to do, even with a condition like asthma. And then number 3 is that I think that you're going to get a lot more benefit out of being in school and being around your friends and being in class than you are going to be with the risk of self-isolation and being at home. So all of this stuff does have to go on the balance, but we have to take into measure the full measure of that child's health. And that might include making sure that your child is in school, even with comorbidities. And then finally, you don't have to go back, but finally, I cannot also forget to mention that schools offer lots of supports that we just don't see, and that included with many children with IEPs, individual education plans, that provide physical therapy, emotional, psychological therapy, occupational therapy, and speech therapies for thousands of our children in our community. So those are things that are absolutely important to be found in school, and those will definitely be part of that decision tree when you're weighing whether to send your child back. And then, I do want to briefly touch upon how we can support our students and also support our schools during this difficult time. This is going to be a time that is absolutely going to lead to frustration. Plans may change. Schools may be open and then they may be closed. Schools may decide to do things one way and then decide that's not working. We're either sacrificing too much in education or it's just not quite the safety threshold we're looking for, and things may change. And that is going to be frustrating, I think, for everybody. But we have to remember the big forest from the trees, okay? And that is that closing down schools as a public health measure is something that we are doing to protect others, okay? We're doing that really to protect our vulnerable adults in the community, to prevent big spikes in coronavirus, to keep the curve flattened. And we have to remember what children are sacrificing, okay? And try to keep that big picture in mind as we are doing this. Every decision is being thought out so carefully by our administrators, by our teachers, by health professionals to keep children in school and do that safely. And I believe as a pediatrician, as I look over these plans, absolutely that this is taking place, and that coronavirus, if all of these measures take place with focusing on social distance, maybe not 6 feet, maybe we're going to be able to accomplish 3 by wearing masks, by focusing on hand hygiene, by focusing on the engineering of how children go in and out of schools, that your child is going to be safe, that we are going to be able to protect our staff workers at schools. I believe that very confidently. And again, as a parent sending my children to Fort Wayne Community Schools, go Irwin Rockets, by the way. And here are a couple of things that can help. One is, let's make sure that we have a good attitude, okay? And our attitude towards our children is going to be infectious, okay? We need to start getting them excited for school now. Our hesitations and some of our things that we are worried about don't necessarily have to be reflected into our children. We can get them excited about learning again. We can get them excited about seeing our friends again. We can definitely prepare them that things are going to be different. You guys, listen, my years as a pediatrician has taught me a lot of things. And one of those things is children are resilient. They are malleable. We need to give them more credit for being able to adapt, to be able to sit still and wear a mask. They show this time and time again. And who is the best person for getting them to do things that we won't expect? Man, these are teachers, okay? If you haven't, we can't hug our teachers, but when we can, man, we've got a lot of debt for hugging and supporting our teachers because they are absolutely incredible. And I believe with a high degree of confidence that, these kids that I see running around in my office, they sit still more often than not in the classroom because they are following a direction and example by child health professionals, which are our teachers. So attitude is really making sure that we are imparting a positive attitude for our kids to get them excited for school. Also being flexible with when things are changing with our school administration, giving them the benefit of the doubt that they are doing everything they can to make sure that schools are open and that they are open safely. B is for balance. I think that for me, this is just making sure that, when we have kids that are going and hugging each other because they're really excited, that we don't overreact too much, that we give redirection, that we give positive reinforcement for social distancing and hand washing, and not consistently focusing on the negative. C for me is comfort. This is again, that goes back to practicing our routines, okay? So things like wearing a mask and practicing hand hygiene, making sure that they're singing songs while they're washing their hands, making sure that they're practicing wearing their mask now, and also making sure that you are leading by example, that you are also wearing your mask in public. I cannot stress this enough. The big goal is to protect our community. And so if we're going to protect our community, then let's do everything we can. That means we need to be wearing masks more often than not. And we need to be showing our examples for our schools that we are all in for them, open safely. And that means we got to get our coronavirus numbers down. D is for details, just briefly, just being aware of the rules that your school is following. And if you have questions, ask. Trying to figure out what to do when your child has a runny nose or a cough. All of this is going to be published and is going to be accessible from your schools. And it's important for you to know those details, not only to educate yourself, but also to educate your friends as well. And I think all of these things together, if we can master this A, B, C, D, and if we can do our best to arm our children and to get them excited, this is going to be a successful school year. It's going to be different. It's going to be a challenge, but it is going to be worth it.
Well, thank you for all that great information to all of our presenters. We're gonna jump into question and answer now. And I mentioned earlier the chat function. I actually meant the Q&A function at the bottom of the screen. So if you have those questions, you can submit them. We've got a number of them that were pre-submitted, so we're gonna go through those first on a series of slides. Just a quick reminder, if you can't stay on with us for the Q&A, you will be getting these, all the slides, including the questions and answers. So those will be coming to you in an email following the webinar. So the first question, what are the guidelines for when a student should stay home from school? Can we talk just a little bit about that?
Mindy, do you want to do this one, or I'm happy to as well?
Go ahead.
This is actually a very difficult question, and we're going to do the best we can with it. Symptoms of coronavirus do vary a little bit from child to adult. Children are much more likely to be asymptomatic, which is why, thankfully, we are seeing a very small percentage of children actually spread it to children. I'm talking about the children 10 and under, which is why we feel a lot more comfortable with kids going to school and being physically present at the younger ages, and maybe working with alternative models for the older children to keep things a little more socially distant. But the big symptoms for children that we are finding is diarrhea. Actually, is a really big symptom of COVID-19. Loss of taste or sense of smell is rather specific for coronavirus and should be taken very seriously. And then you have the rest of the viral symptoms. This is true for any virus that a child may have. And so what is so important about having symptoms is trying to make sure that can be put into a clinical context. And who better to do that is than your doctor. And I will tell you that Parkview pediatricians have taken a lot of efforts to expanding our hours. We're now starting at 7. Some of us, we're now going until later in the evenings, and we have our walk-in clinics that are robust and open, so that when children have symptoms, we can safely get them home, get them evaluated, and get them tested as quickly as possible. Because as you'll find out, is getting that return feedback from a physician is going to be very important for their return to school. But these are all the symptoms, and until we have a little bit greater handle on the community prevalence, we're going to have to take these symptoms seriously and keep these children at home.
Let's talk about if my child becomes ill or has symptoms, what should I do? Seems to be fairly straightforward.
It is, but so important, guys. Dr. Nip did a great job of talking about prevention being the key. So certainly when coronavirus does come into the schools, again, I feel very, very, very confident that through social distancing, wearing masks and hand hygiene, we are going to prevent the spread of that situation. But remember, an ounce of prevention is worth a pound of cure, and keeping that child home is going to be the most important thing we have. Keep our schools open. So we want you to stay home. We want you to contact a family doctor. And if you don't have one, boy, please call and we'll get you set up. But it's going to require a big concerted effort from the medical community and the school nursing staff to make sure that we keep these kids, get these kids evaluated and back to schools as soon as safely possible.
Let's talk real quick about what if my child is symptomatic, or we get a positive test. Who do I report that to?
I'll go ahead and take that one. You'll want to report that obviously to their doctor to work through the medical condition part of it, but to the school as well. And the school will then communicate what would need to happen, and it would also communicate it to us so that we can work through those things. As time goes on, it'll become more important. So some of the things, as far as what to report, if they exhibit symptoms, make sure that they're not at school, as Dr. Giaquina said. And one thing to throw in there is things that are not otherwise explained. So if your child has seasonal allergies and it's very consistent with what they have at that time of the year, and that's sort of validated, that might be able to be explained. But otherwise, we're looking at things where their symptoms expand beyond what's usual. So if they normally have a little bit of a runny nose, but they're also now coughing and have headaches and those types of things, then you would want to consult the doctor and possibly seek testing. And if there is a positive test, if a member of your immediate family has a positive test or is told that that they need to quarantine, you'll need to tell that to the school. They then have to report that to us. And then as was said earlier, the schools are removing a lot of those barriers for having less penalties in place for absences and those types of things, sports as well. And the big thing is keeping kids home and us knowing the situation so that we can match that up to positive cases that we get.
Dr. Giaquina, I think you wanted to answer one of the live questions regarding a test response time.
Yeah, the test time response time for Parkview's testing, and this always can change, is about 2.8 days. So anywhere between 2 and 3 days. Now that can vary between testing facilities, but Parkview's has a send out that is around 3 days. And I want to remind families that currently some of the sites do not test children right now, like some of the CVS testing sites. So that is something to consider as well. The easiest way to get tested, again, call your doctor. The doctor can order an outpatient test for them to go to one of these walk-in clinics to get a quick test, or go to one of the, and that's probably the easiest way to do that. But the state is encouraging testing for symptoms, and there should be a very low threshold to do so.
How will parents be notified? How will parents be notified if there is a positive test in the school?
In some cases, if there is a need to reach a greater number of people than we can do by individually calling, there might be a letter or something to that effect that might go out to a classroom or an activity of folks from the school or from us. As we become quickly overwhelmed, and we're seeing that in the last 2 weeks, we are relying on some of the schools to help with the notifications. They can do mass texting, that kind of thing. But it's also important that if we have the names that we need and we know which ones were high-risk contacts, we will only be contacting those folks, the people that need to alter some activities. So what I hear a lot, this is a big question, is will we be notified if there is a case in the school? Sometimes yes, and sometimes no. There is, we are bound by a lot of confidentiality, and some of that can go out the window when we need to reach for the greater good, a large number of people we can't reach. But if we know they are only next to Johnny and Susie, or they didn't participate in this or that or the other sport, we may only be able to reach out to Johnny and Susie's family and have them quarantine. So it'll be very case by case, with respect to those that we don't need to share the information for, and then again with the understanding for those that we might need to share a little bit more to reach the exposed folks.
let's take one of the live questions real quick. One of the questions is regarding buildings without air conditioning, fans not being allowed. What are the health risks with heat and humidity in the classroom?
From a purely medical standpoint, unless the heat is excessive, and we're talking, concerns about, temperatures in the excess, triple digits, I'm much more worried about the quality of education in that situation if, the children are just extremely hot without fans. And so I think that the big key there that the schools will want to work on and be flexible with is how to keep, kids from, being able to be in that situation, whether it might require like outdoor learning or a bigger outdoor space, from remembering my days at Weiser Park and Whitney Young without air conditioning. I remember it not being comfortable, but I don't, from my medical training, there's no health risk per se. It's just really just a matter of making sure that schools aren't extremely uncomfortable for those students.
What happens, let's say my child has to be quarantined. What needs to happen for them to return to school?
So if they, if while in quarantine, if they have no symptoms, while they're asked to stay home and after they're exposed to someone, so if they've had no symptoms while in quarantine, they would need to wait that 14-day period out, and then they can return immediately. If they do have symptoms, what that puts them into is the category of the folks that we're looking for. That's why we have you on quarantine, so they're not exposing others. So what we would want them to do is talk with their physician to see what that plan is for them and likely to be tested. And they will then isolate at home for a minimum of 10 days since the symptom onset. And it doesn't matter what the test result is. If it's negative, they were symptomatic. And unless that can be completely otherwise explained, they would still isolate for those 10 days until the symptoms are beginning to resolve. They have no fever, those types of things, and that it has met that 10-day time frame, and then they can return.
Let's take the same question, but if they after an isolation.
So if they are a case, that means they've had a positive test. Some have symptoms, some don't. So with symptoms, they can return once they meet these 3 criteria, and they have to meet all 3. So they need to be 24 hours without or fever-free without medications to reduce the fever. And their symptoms have to be improving. Now, we do know that some folks are going to have a lingering cough, for example, and that's okay. As long as we're seeing symptom improvement, no fever for 24 hours with no meds, and it has been at least 10 days since the symptoms first started. So if they're a case, they've had a positive test, but they were never symptomatic, and this does happen, they can return when they've hit the 10-day mark since the date of their test.
Thanks for that. I know that we're running up on a time crunch with a couple of our presenters. If there are a number of additional questions that will be in the slides that will be sent to you, so please reference those. The questions that were submitted live, we'll continue to work to get those answered for you. There is a website and a phone number you can call with any additional questions. If you work with Parkview's Business Connect, they're happy to help you and get you answers in a very quick time frame. I want to thank our presenters today. I also want to thank our sponsors, Parkview Health, the Allen County Department of Health, Northeast Indiana Regional Partnership, and the team here at Greater Fort Wayne Inc. So thank you for that. Everybody that was on the call today, you will be getting an email again with the slides, with a link to the presentation, as well as a survey. So thank you for attending today. We appreciate it. Hopefully this information has been valuable to you, and you've got a new resource to contact with any additional questions. Thank you very much. Have a good day.